mission of MCR is to be the provider of choice for everyone in the community, regardless of race, color, creed, or ability to pay. Our vision is to kind of be more present in the community as far as a community partner with other organizations throughout the county, throughout the state. Well, this is a very special event and time for us. We've been trying to get here at Ringling for some time, and they've graced us with their beautiful grounds. It's important for MCR because we get to put our message out, a positive one, out to our community. We want to take care of everyone, regardless of their ability to pay. We want to be present in the community. We want to be community partners with everyone. Well, we have a wide variety of services. We have our outreach department here. We actually go to the migrant community and we talk with them about opportunities and the different medical services we can provide. We've got our medical bus here behind me. We have our vision bus. We have our dental bus out here. But we have other services and specialty services. Besides our primary care of family practice, internal medicine, OBGYN, and pediatrics, we have a vast array of specialty services that we can provide to the community, such as orthopedics, podiatry, GI services. We have pain management. We have cardiology. We have general surgery. We have a vast array of specialty services so that we want to be your provider to take care of all your needs within our circle of care. Well, we have a big diabetic problem throughout the United States. I happen to serve on the Diabetes Advisory Council for the state of Florida, and it is a very prolific disease process that doesn't affect your blood sugar. It can affect your eyes, it can affect your kidneys, it can affect your feet when it comes to undergoing amputations. So you lose feeling in your feet, you lose the type, what we call neuropathy. So diabetes affects all organs of the body. Those are the types of things that we want to address and attack and allow people that information and the education so they know when to come in and to make sure they get checked on a preventative basis before it becomes a crisis. High blood pressure is what's known as the silent killer, and a lot of people don't realize that they have it. That's why it's important to check and to be checked with your primary care physician at least once or twice a year. Now, depending on what your blood pressure is, they may put you on medication. You may have to see them a little bit more frequently. But it's important to keep that high blood pressure to a manageable level and on a stable basis because that can lead to strokes and heart attacks as well. Well, I want to put my first congrats and my shout out to the outreach team, our facilities team, that have put this beautiful event together for us. They are the nuts and bolts of what we do. Now, as far as the providers are concerned, we have great providers. And when I'm talking about providers, I'm not just talking about the physicians that deliver the care. I'm talking about our front desk. I'm talking about our nurses. I'm talking about the people that make the company run. Those are the most important people in the company. Without them, we couldn't do what we do. I'd like them to know that, we take care of those people sometimes that no one wants to see. And we are willing and able to take care of those individuals as well as the people that have the means and can afford health care. We want to be a partner in the healthcare community. I want them to get information. I want them to understand the services that we provide. I want them to look at the resources that we have available for them, whether they have insurance or whether they don't have insurance, whether they need a COVID vaccine, whether they just have questions about their health, even mental health, behavioral health. Any question is appropriate to ask and get that information at this health fair today.
My name is Tabitha Ball. I'm the Chief Operating Officer for MCR Health. I'm here in the great event that we're having for the community. One of the things that we want to make sure we capture as we provide health care is to provide holistic care. So these type of events actually take care of the whole person. And so I'm here today to just help join in the efforts that MCR is doing to just make sure we're providing that type of service to the people that can't, that are underserved and that are uninsured. I think it's important because a lot of times people don't know what we do. People don't know that we actually do provide services for people that are uninsured and underserved. So this type of event, being at the Ringling, that is so popular to tourists, once people come out, they'll be able to identify what we do and be able to schedule appointments with MCR for anything that they need as far as specialty and well visits for adults and children. The mission of MCR is to provide, quality care services to the highest point possible. And again, from specialty services, which is very unique to an organization like us. A lot of organizations, they are able to provide primary care services, but specialty care is something unique that MCR provides. And we provide it at, a sliding fee scale for the people that cannot afford it. So we try to, again, meet people where they are in the community. If they can't afford it, we want to be able to help them get back to health. Well, I think this has been something in motion for about 3 years. And with the efforts of our marketing team, we just kind of continue to, in our outreach team, we kind of continue to just ask Ringling, promote ourselves to them so they can know, again, what we offer. And then once we identified that to Ringling, they invited us with no problem at all. Well, we want to make sure we target all communities, all populations, but particularly Hispanics. A lot of Hispanics, they're undocumented. A lot of them do not have access to the resources that a lot of us have. And so to be able to offer it to that population that don't have the healthcare services that they need, it's a win-win for all of us because they're able to, again, be healthy. We decrease ER visits. We're able to get them into care and provide routine care at all levels of service. Well, we want them to know MCR Health and what we do, and we also want them to know that we're here for the community. We do outreach screenings. As you see, we have our primary care bus, we have our dental bus, and we also have vision. And so any health needs that the community have, we're able to even bring it to the doorstep of their homes and in the community. So that's the number one. People that don't have transportation a lot of times are not able to make it to appointments. So we have these mobile units that can come out and meet people where they are. It's the most important thing that we want to make sure people take away from this. Whatever you need, we are available to take care of those needs. Again, from pediatrics to adults to geriatrics care we provide. MCR, we're very diverse, and so culture, sometimes people, especially the Hispanic population, there may be, their language is different from Americans, so we have a very diverse population that provide these services. So when people come in to any of our health centers across Bradenton and Sarasota and Arcadia even, we have people that can actually, again, meet them at the door and meet them where they are. And so I would want people to know that please make an appointment. Please, you're able to walk into any of our clinics. A lot of our clinics are extended hours to 8 o'clock p.m. So again, whatever the needs that we feel are in the community, we're here to meet those.
Good afternoon. Dr. Dedrix Daka, VP of Optometry with MCR Health. Today we're here doing vision screenings for the community. One thing I love about MCR Health is we're always doing vision screenings, giving back to the community. But this really allows us to reach out, speak to people, show them the importance of getting their eye exams, answer questions, and ultimately help to get them to services as they need. Vision screenings are very important. A lot of times people don't realize when they are having struggle or blur with their vision. A lot of times kids cannot really report when they can't see. So a simple screening can really give a parent or a patient the opportunity to understand what could be there to help them. A lot of times people are not aware of diseases that can occur in the eye, and screenings can kind of alert them if they have something to keep an eye on. So as a community health center, it is so important for MCR to continue to participate, give back to the community, engage, meet people, work with vendors, but mostly let the public know that we're here for them. We're a non-profit organization. Our leadership is always geared towards giving back to the community. So events such as these are very important, and I'm glad that we're here. So we get the opportunity to meet with our registration team. They're going to get some baseline data on the patients to allow our technicians. You will see one of our technicians as part of the screening, and the technician is going to do some preliminary testing, and then one of our providers will give the opportunity to kind of discuss with the patient what was observed in the screening, provide some, brief recommendations, and if anything is critical, kind of provide some recommendations on what to do with that. Yes, so that is one of our major initiatives is addressing diabetic retinopathy. One thing I like about MCR, it's a comprehensive approach with our family physicians, our podiatrists, our internal medicine, and also our specialists. So we look at it really from all sides, but diabetes is one of those things that if you don't catch it early can cause some really expensive and really damaging changes in your eye. So early detection is important. So when we see somebody that could be at risk for that, we really try to gear them towards those services. Yeah, very, very good question, very good point. There is a use for eye care at all ages. For the very young, children can be in school and not really understand challenges they're having with their vision. They could not understand eye strain or headaches, or maybe struggling in school and not realize that the eye care is a component of that. Also, in the older side, there's things that develop in our eyes as we get older: cataracts, glaucoma, diabetic retinopathy, macular degeneration. And some of these things don't really have a lot of warning. So being able to have a good partner you can trust with for your eye health is very important. So it is such a pleasure to be here participating in this event with the Ringling. This is the best community in the world. It's growing, but it still has a small community vibe and connection. And it's great that MCR is here offering these services, but it's great to be a part of this community and continue to see Manatee and Sarasota County grow further.
My name is Colette Saikati. I'm a dental hygienist. I work at MCR. I'm here today to do screenings on the dental bus. Screening's pretty simple. It's just a quick look inside, check what patient has going on, if they need immediate care or if they just need general basic care, then we get them referred to our offices to get started. At MCR Dental, we help with general things such as cleanings, exams, x-rays, and we also do extractions, fillings, and sometimes crowns. With children, we try to start them off on a good foundation with good hygiene. We make sure to let them know how to brush their teeth, how many times a day, for how long, teach them how to brush correctly, teach them how to floss correctly. So if someone does not have dental insurance, we offer them a sliding pay scale. So we do offer discount services to our patients if they need it. I would like them to know that we have 2 offices. We service adults and children. We have lots of friendly staff. We offer full service dental, and we can get them established today. I think it's important because it brings together all the different aspects of health in one place. And it couldn't be a more beautiful day. I mean, we're on the water here at this lovely museum.
So MCR has a wonderful diabetes education program, and once patients are referred to us, we spend a full hour sitting with the patients and talking about diabetes, what's happening in their bodies, how they're taking their medications, if they're taking them appropriately, and ways to manage it with nutrition information and exercise. If they need additional help, they're seeing frequent doctor's appointments every 3 months, and it's not a one-time appointment. We will see the patient for as many times as we need to until we know that they're managing appropriately. Type 2 diabetes is very, very prevalent in our society. It's hereditary. A lot of people inherit it through their families, and it can be prevented very well by proper diet and nutrition. They can definitely schedule appointments with their primary doctor. We can monitor and diagnose diabetes based on a blood test called an A1C, and we can go from there depending on the results of the A1C. Most importantly, for diabetes prevention, the best way to eat properly is by avoiding excess sugar in your diet, cutting down on the soft drinks or eliminating altogether soft drinks, sweet juices, iced teas, Gatorades, all those foods that are such a big part of the American diet but contain so much extra sugar.
My name is Erica Albury. I work for the Suncoast Campaign for Grade Level Reading, which is part of the Patterson Foundation, and we are here to promote the love of reading, to prevent that summer slide, to make sure that kids in the community have opportunities to have access to really quality literature to keep them reading when they're not in the classroom. It does, absolutely. And I think children who do find that love of reading, they do learn a lot of things. They are helping them grow. It's helping them build family connections, community connections, their confidence. It has a lot to do with their mental health and their stability and happiness in the classroom. If you want to, we have our newsletter that you can sign up. We also have programs and different things that we run throughout the year. The most recent one we've been doing is This Book is Cool, which is a program that gives books to students, a backpack actually of 20 books that if they signed up for, they would get that to help them also promote and keep them from losing that summer slide as well. That all types of health are important, and a lot of things you might not consider health actually are there to help and benefit you and help the kids be the best little humans they can be.
It is important to share with the community what services our district has for current students or future students and what our schools provide, as well as to share the different positions, available positions that we currently have for anybody that's looking for a job. Absolutely. It is important to have events such as this one where we can provide health services, free health services to our community, especially to our Hispanic community, so they can come take care of themselves, because if we have healthy adults, healthy parents, then we can have healthy children that come to school and they can find the resources that are available in the community at low cost or no cost to them. That we are a community and that we are here for them, that we are here to serve them and to provide them with services that are going to help them to be better and to be better for their family. It's important that as parents, we take care of ourselves, of our health, because we are giving a lesson to our children that health is important so they can stay healthy because if we take care of our bodies, if we take care of the inside of our bodies, then we can flourish from the outside. And it's important to always do our checkups, to have our kids up to date with health services so they can grow healthy and beautiful.
My name is Dr. Randall Morgan. I'm an orthopedic surgeon. I'm also the Director of Musculoskeletal Health Services and Operations at MCR Health. And we are here as a part of the MCR Health Fair to explain to all of the community about the orthopedic services that we have, along with pain management services in our company. Well, orthopedics affects everyone from the cradle to the grave. So we see a lot in our company. We see a lot of adults who have orthopedic problems, knee pain, back pain, shoulder pain, as well as, of course, fractures and, those types of injuries. So we cover the spectrum. We do everything, including spine, and we're able to provide consultations for patients and second opinions, as well as takeover of care if that's necessary. We see a few children. Certainly, we have a very large pediatric practice with MCR, so we see pediatric orthopedics. I'm actually a pediatric orthopedic surgeon myself. So we do the common types of problems that children have, fractures, some of the growth problems that they have. Locally, more complicated things with regard to children, we tend to refer to the All Children's Hospital. Well, we want to let them know that there is a very excellent health care alternative for them in the community. Nobody should be without a doctor, and nobody should be without health care. So we take care of everyone. We have all people in the community, and we have a very multicultural work staff as well as patient group. So that's what makes us unique, we think. Well, we have a very large Hispanic population of patients, and also we have a large Hispanic representation in our workforce. And so that helps when people come and they have language problems. We can always have really excellent translation, and that's very important. Well, that if MCR were not here, we would have catastrophe in terms of health care for our community. We're fortunate on the Gulf Coast of Florida to have great medical care, but some people don't have access to that care. MCR makes sure that everyone has access, and I think that's extremely important.
Hi, my name is Melissa Rosenberg-Ehrman. I am the Manatee County WIC Director here promoting our services. We're also promoting services of the Manatee County Health Department, programs such as smoking cessation and our STD programs. We do provide a wide variety of services, starting as early as pregnancy. So our Women, Infants, and Children program, the WIC program, helps to provide nutritious foods to give those moms a really good, healthy pregnancy so that their babies can have a healthy start in life, all the way up to smoking cessation for adults. We have some STD programs. We also provide education and referrals to other local resources. We just try to get that message out there that we want to be the healthiest county in Florida. Well, we're serving the community. We want to make sure we are trying to get our community members off to a good start in life and then all the way up through their aging, keep them healthy. So our mission, vision, and values really focus on that at the health department. Our goal really is to be the healthiest county in Florida. Yeah, we just want to make sure we're getting the most recent information, science-based information out to our community. We try to set up some really active COVID vaccination clinics, and we also provide other immunizations. So yeah, I mean, it's important just to be out in the community so they know what we offer and that we can help them stay healthy. The biggest thing that we want our community members to take away are just how many different services we do provide, any way that we can help them stay healthy, and really just whatever we can do to be of assistance. Also connecting with some other community partners so we can make sure that we're all working together towards that common goal. I would say biggest takeaway is we're here to help. We're here to serve you in any way that we can, just to make sure that you are keeping up with your health and really being able to work and play and live in Manatee County the best that you can.
Dr. Stephen Greenfield, been here for close to 40 years now. Had my family practice in Palmetto and then retired. Now I supervise practitioners for the company. Because there are so many in the community that have no idea how they can get access to health care. And we do access for everything. And Brandon here does HIV and Hep C and all the help for the medications and the counseling. And then the rest of us do regular medicine. And during the COVID pandemic, we did more COVID tests than the health department. And we have 19 sites. So we're in multiple counties.
That's very true.
So when people come here, they want to know, well, where can they find a doctor? And yes, we did live the way. And now, since I saw you last, we have orthopedics, we have dermatology, we have wound care, we have pulmonology now. We have a pain doctor, we have a gastroenterologist, we just keep building and building and building.
Oh yeah, so at the Southwest location, we manage a lot of HIV and hepatitis C, and I have a lot of support. So we have case managers to help get the medication. We have case managers to follow up with the patients and make sure they're doing okay. They can help with some housing programs, some food programs. We have behavioral health at the location, so we have a lot of help.
I think a preventive healthcare is the most important thing as a pediatricians we do, although we take care of all the chronic illness, acute illness, and we have a great staff regarding with pediatricians, nurse practitioners, and support staff, nurses.
Vaccines.
And that's important. Nowadays, we emphasize how important immunizations are. And also, go to your doctor, get checked, because a lot of prevention is a role, how can I say it? Prevention care is super important. It will tell you what the problems are, and once you identify them, it's easy to fix. So we care about that.
Remember, we have what we call a sliding scale program.
That's right.
So for the people who can't afford regular medical care, they come to us and we take care of them, whether they can afford it or not. And that's instrumental.
No, I mean, we see everybody. It doesn't matter if you have insurance or you don't have insurance. We just care about the patients, and we just try to provide the best care that we can, and I think we are all ready for that. As I said before, from immunizations to chronic illness. And it doesn't matter. We have multilingual offices where we speak all kinds of languages, and even we can use a language line, even if we don't speak that. And I think it's very important because we can communicate with the patients, and we are part of that. We are part of that community, so that's what is important.
Many of us are multilingual. So we speak Spanish, and we can make sure somebody in the office they come to speaks Spanish. But when you talk about the Hispanic community also, our obstetricians, our OB-GYN department, delivers at one time close to 3/4 of the babies born in the entire county.
I did not know that.
And we have several obstetrician gynecologists that we are dedicated providers. We want to give back to the community, and people need to know they can get excellent care if they come to any MCR office.
I would say to not be afraid to ask for help and to come to your doctor's appointment. So the hepatitis C medications can be $70,000, but I've treated multiple patients who don't have insurance, and I hear a lot of times people are scared to go to the doctor to get treatment because they think they can't afford it. But treatment here is affordable, and we want to help.
That we are here as MCR, and we are ready to take care of every medical needs they have. Así que vengan a vernos.
My name is Esperanza Gamboa. I am the Director of Outreach and Community Relations. And we are here today because we are celebrating the Arts and Health Fair of MCR and the Ringling Museum. It's important because we are partners, MCR and the Ringling, and we want to make sure that we have our patients, our community, to feel comfortable visiting the beautiful exhibits we have at the Ringling. It's the day for the arts. It's a day for the medical services. We have free vision screenings, we have free dental screenings, we have free vaccinations, and we want to make sure that the community have the opportunity to visit today for free all the exhibits of the Ringling and at the same time enjoy all these wonderful medical services. We have the doctors, pediatricians, we have free food, we have healthy vegetables, and a lot of information about prevention and well-being. Yes, we have many services. We have 25 clinics, correct? I have next to me here, this is Misa Julien, and she is the Director of Marketing. And Misa, you want to say something?
It's important to market MCR because we want everyone to know that we have that connection with the community. We take care of the uninsured, the underinsured, the fully insured. We take Medicaid and Medicare. So we are an important part of the community, particularly for those that are in need.
I have here Maria Rios. Maria Rios is also one of our lead supervisors for the eligibility department. And Maria, you want to say something? The services that we provide, free Medicaid, free marketplace application for our community?
We're just here to assist anybody that needs it. Come on by, call us. We're there for you.
Well, MCR have the goal to work really hard for the well-being of our patients and our community. And 5 times a year, we decide to have these wonderful big health fairs. We go to different counties, Manatee, this is Sarasota. We go also to DeSoto County. And what we do, we go and we bring the information and the services, all the free screenings, that they can see the multiple services they have available. We have discount fees. We serve the uninsured and underinsured. Then if you don't have insurance, that's not a justification not to go to the doctor and take care of your health. Please attend the doctor at least once a year and make sure you take care of your family.
We hope that everyone gets a sense of the type of services that we provide and that we are in 4 counties and we are there for them wherever they are.
And exactly what Misa had said, we want people to know that we are here and we are here to help.
The more important things is the visibility. We have hundreds of people, they will choose to go to the hospital when they have an emergency, and we want to tell them, please do not wait for the emergency. Bring your family members, your children, yourself to our clinics, to our health centers, and take care of yourself. Once a year, you should do the regular screenings. And if you don't have insurance, we can help you with that. We can help you apply for insurance, for Medicaid, or for discount services. MCR is really extremely important for our community. For more than 40 years, MCR had been here serving our community. Our patients, we are serving their children, their grandchildren. It's a family doctor place. Is the place where you go when you have a situation, and you know all our staff members, you know everybody. Then come to us and we will take care of you.
Well, Well, my name is Jessica Clark, and I'm an event and rental coordinator here at the Ringling. And I'm here today with Ms. Esperanza with the MCR organization, and we're putting on a joint health and art fair for the general public. It's a free day to everyone here at the museum, and they get to go through and get some health screenings, get some great information. It's a great partnership. Well, here at the Ringling, our goal is really to reach out to as many people as possible and show our exhibitions and show the diversity of our collections and what we strive for here at the Ringling. So when they came to us and wanted to partner and also reach out to the same demographic, the same people, to provide an opportunity for them to not only have this healthcare, but also have access to these museum and our exhibitions, it was just meant to be. It was just meant to be. We really, really strive to reach as many people as possible, and so this is a great opportunity for both of us. It means the world. So we are actually open to the public for free every Monday, but most of the people that are here today have their families with them, young ones, and during the week, I'm a mother myself, we don't have much time to do much of anything. So having a Saturday where they can all come together and experience this is actually pretty remarkable, and it's a group of people that we generally wouldn't be able to reach out to on weekdays. I absolutely would agree. Our education department actually is doing some art shows and art activities in a couple of our buildings here. We are actually actively building an education program to incorporate these younger audiences and their families into the art museum as well. There's so many things. This beautiful space, the beautiful culture, the family environment, the partnerships, the energy. I mean, just enjoying your family on a beautiful Saturday and also taking care of some of the things that we need done on day-to-day life. So what I would like for them to know is that John and Mabel Ringling, when they passed, they had no children. They donated their entire estate to the state of Florida to be shared and viewed by the public. And that to me is amazing and beautiful, and they've created a space that they created a family of their own, and this is their family, and I would like that legacy to continue. That's what we're fighting for.
My name's Linda Snyder. I am Chief Compliance Officer with MCR and also Vice President of Human Resources and Programs and Policies. And I'm here today to celebrate this wonderful event that MCR has put on in conjunction with the Ringling. What a beautiful venue we have here today. So MCR is a very broad-based agency. We offer a lot of specialty services, continuity of care, support services, and bringing that to the community is really important. And what better way to do it than have our providers here, our nursing team, offering testing, and our dental buses, and it's just bringing that and partnering with art. How important is art? And art and health, who would have ever thought to have that marriage? I mean, just a wonderful thought. Our providers are very dedicated. When we interview for new providers especially, it's about the mission of MCR and who we serve and giving back to the community and really looking at serving a community-wide need. It's a calling, and I think that all of our providers, support staff, and nursing team recognize that calling, and that's why they're here, and that's why they stay. Well, I think it's not only important to MCR to bring our message to the community, but to the community itself. I mean, I think there are a significant number of folks in the community in the 3-county area that we serve that maybe aren't familiar with MCR. And so bringing our activities and our services to the community is the best way to be able to serve them. Actually, MCR is out there to meet the need of the community. And because of that, what we strive to do is identify that need and then attempt to serve it. So bringing on our office-based lab where we can provide some surgical types of services to the community. Folks that would typically not be able to afford that can then access those services. Bringing on additional specialty services and looking at where the population resides so that we can open new locations, be it in Sarasota or Manatee or DeSoto. Well, that is part of our mission, is to make services available to all, regardless of income or demographic. And I think it's important to the community to maintain a healthy community. It's not about when you knock on the door to MCR who you are, it's how can we serve you. We strive to have our staff maintain the same demographic as the patients that we serve. It's important culturally, ethnically, to be able to meet the patient where they are. in their healthcare journey. That MCR and Ringling are here to serve, and we welcome you to visit any of our sites. And speaking for Ringling, I'm sure they will welcome you to visit this beautiful location. I think that MCR provides a significant amount of preventative care, and so don't avoid coming and knocking on our door. Come in for a wellness visit, come in for some routine services. We welcome you, and so please take advantage of our sites, mcr.org.
All right, my name is Caitlin Shanley. I am the Outreach Coordinator and Community Relations at the Ringling Museum, and I'm here today to help out with our amazing events partnering with MCR Health, and we have some really great family programs going on today as well. Absolutely. We have free family programs all year round at the Ringling Museum. We have programs for all ages, stroller tours for our youngest friends and strollers. We have our ROAR program, which is a story time and early literacy program on Thursdays and Friday mornings for our toddlers and preschoolers and any friends that still enjoy a story time. And then we also have a free family program at the first Saturday of the month, which is our FAM, our family art making program, which is available for all ages. We're really committed to having free family programs here at the museum and doing outreach in the community for children and families that may not be able to visit, because we think that coming to the museum, having a museum experiences, making arts, whether you're at the museum or in the community, is so instrumental to kids of all ages. Absolutely. You can see our free family programs on our website, ringling.org. You can also follow us on Facebook. If you type in Family Programs Ringling Museum, you'll find our Family Programs Facebook page, where you'll get all of our latest up-to-date information and our calendar for the summer program schedule. Oh, this is fantastic for the Ringling. We're always looking for ways to bring the museum to families, individuals, people that may not have ever visited before. So this is a great way to show the museum and all that we offer to our community here in Sarasota. Oh, I want people to take away that just how great the museum is, how much is here. We have a beautiful historic house. We have a wonderful museum of art, a glass pavilion. Our grounds and gardens are fantastic to walk around in. We've got an amazing playground, and our education center has free family programs all year round. So there's just so much to do and so much to see, and we're so happy partnering with MCR Health and bringing more people to the museum to see everything we have. Oh, I would like to say, come on out to the Ringling Museum. Check us out. We always have new things on view, new exhibitions always here. There's always something new to see, something new to create. So really come on down, visit the museum. It's so important for families to bring out their kids to the museum, see that museums can be fun. So really come on out, see what we've got.
Well, just look around. We're impacting lives. You have different medical screenings that's taking place. You have people out by the water enjoying themselves. The service of MCR is spreading its wings and making sure that we impact those that are underserved and underprivileged. And it's an exciting opportunity, great fun to be out here. Beautiful atmosphere. Well, you have to commend the brand of MCR for continuously being the leader in the community when it comes to healthcare. It's an exciting opportunity when you sit back and you think about the lead that was taken, during COVID when there's a medical need, and how MCR has the ability to impact those that need service at that particular point in time. Just looking around here and thinking about where MCR started and where we are right now, thinking about our service area and how we continue to look to expand so we can impact ages from birth all the way to transition. It's a great opportunity. I think it does just what MCR is, want to embrace all ages, all walks of life, and just looking around, looking to see some of the cute babies and the atmosphere of the dance and the fun. I think what it does is acknowledges the impact that MCR is doing in the community. This is an exciting opportunity for us. My biggest thing would be to make sure you understand the importance of MCR and understand the reach that MCR has in Manatee County, whether it's jobs or whether it's actually impacting through healthcare and spreading out to the community. We were just talking about an upcoming event as far as a backpack giveaway that we're going to have. MCR is for the community, and it tends to continue to be in the community and doing great things. I want them to enjoy themselves and the fun and take advantage of the idea or the opportunity of being educated in healthcare. Get some of the screenings, whether it's dental, whether it's eye, whatever the opportunities are, because healthcare is so important when you start talking about quality of life.